live. Okay, Jory. Today there's no, unfortunately, no toothbrushing videos. Okay, and but we have a live session here. Okay, I think many people are asking about having a live session so that we can chit chat and can ask your questions, and I'll be here to answer. Halloween Senpai reacts. Let's go. Yeah, 0 seconds. Yes, we're live. All right, and yes, hi guys. Hi, Kanan. Hi, Joseph. Hi. Yeah, hi, Elena. Hey, Dashing Web. Hi, AJ. Amin. Hi. All right. Okay, from TikTok. Okay. All right. Hi, Media Text. Okay. Yeah, guys on TikTok, remember to like and share so that more people can see this. Also, YouTube, so that more people can see this. Where you're watching this from? Okay, I'm in Singapore. I'm now in my car, doing a live in my car now. I just had my dinner with my wife at the M Hotel. Okay, so my wife is downstairs enjoying her dessert while I'm here enjoying my time with everyone here. All right, so yes, I just had my dinner. Let me know where you're watching this from, and yes, let's get to know everyone a little bit more. All right, from Middle East. Okay, we have friends from Afghanistan. FR Boy 08. Hi. Thai 10 May. All right, lots of love from Nepal and from Singapore and from everywhere also. All right, you're from Singapore, from Malaysia. We have friends from Malaysia. Doing great. Just have a dinner. We have a laksa, seafood laksa dinner at Ham Hotel. They're running some promo. Yeah, some promo. Very nice dessert and food over at M Hotel. Yeah. I think is it Cafe 2000? Yeah, I just have dinner there. Now I'm in the car park in the hotel lobby. Yeah, so doing live with everyone. Actually was planning to go back home to do live, but I forgot that tonight got the I promised my wife for dinner, so that's why but I can't cancel this live. I really promised you all, so that's why we are here in the car. All right, guys. Hi. Yeah, lots of love from UK. Yes, Mongolia. Hi, friends from Nepal. Hi. Good. Many friends here. What time is it now? I think 8. I think now it should be 8. Okay. Thanks for the super chat, guys, on TikTok, and all the diamonds or gift from TikTok and YouTube. Thanks for the rose. Okay, Arami. All right, good. Thank you very much, guys. Okay. Yeah. Like and share. I think that's appreciated. Gifts are great, but not the most important, guys. Okay. Thank you, guys. Good. Yeah, good to see everyone here. All right, and now we are 8. So actually we started early. All right, my daughters, they are at home. Yeah, I'm in the car. All right, like I said just now. Yeah, supposed to be at home doing live, but I planned out. I forgot that I actually supposed to have my dinner time with my wife. So that's why we're out at M Hotel. All right, M Hotel. I'm in the car park in M Hotel. Just had my dinner. All right. Yes, here from YouTube and TikTok. Yes, we are doing a live session on TikTok and also on YouTube. Okay. Thanks everyone for being here. Good. Hi, Jamie. Hi. Yes. Okay, Kate Lim. All right, friends. Wow. Tan Ito. Hi. Yeah. Shout out Flame. All right. And thanks. All right. Let's pin S. Let's pin us 6. All right, good. And yes, I'm Asian, Singaporean, Chinese. All right, and yes, I've seen everyone here. Wow, there's so many familiar faces. All right, it's Senpai. Hi. My day was great. Busy day in the clinic. So doing quite a number of wisdom tooth surgery. One of the things I do a lot more is wisdom tooth surgery. In fact, I don't do a lot of things in my in dentistry. I'm more in preventive, so I do a lot of more cleaning, fillings, preventive. Wisdom tooth surgery, I have keen interest in wisdom tooth surgery. So today I actually did 4 wisdom tooth surgery. So quite a bit. Yeah, it's quite fun. I do enjoy wisdom tooth surgery. Not to shock you all though. All right, I think I'm a dentist, so there's certain procedure that I like more. Yeah, good. Yes, Kate Lim home. I seen you a lot of comments. All right, good. Roblox game 335. Yeah. Recently I just realized a lot of people are adding me on Roblox. Just because of one of the game I played on Roblox. Not active. I'm not active on Roblox. I play a lot of Mobile Legend though. Crazy. A lot of Mobile Legend. Crazy. Crazy a lot. Yeah. Alright, Roblox is fun, definitely. I agree. Yeah, I played Squid Game. I saw someone play Squid Game on Roblox. That's why I went in to try it out. Yeah, it's fun. It's fun. So many games on Roblox, really. Wow, it's so much. Yeah, you're not late. Yun Yan Yue. I'm early. Alright, it's just that I'm early. Alright, guys. Okay, and wow, TikTok said that I can fight the virus. I don't know what's that though. Anyway, I'll just fight the virus and I receive a piece. Anyway. Alright. Can you try making Squid Game candy? Not really into making. I love Squid Game. I love Squid Game, really. I love to play Squid Game, and yeah, it's quite amazing, this Squid Game. Thanks for the face mask. So many face masks. Wow. Alright, thanks for all the face masks. Stay safe and stay well, guys. Okay. Wow. Cotton. Wow, 65 face masks. Wow. My clinic is in Singapore, Tanjong Pagar, St. Andrew's Dental Surgeon. You can check out link. In fact, I have put in a link tree, so with all the links that you want to have a look, if you want to have a look. Alright, you can check the link in the TikTok bio or in the YouTube description. There should be a link tree there. Yeah, good. How often should you get a dental checkup? Okay, good to see a dentist once every 6 months. Okay, I think that would be a good idea. If you really want to push, then it would be once every once a year lah. That would be what we're looking at here. All right, hey Jess, Dentist Jess. Okay, good to have you here. All right, good. Dentist Jess is a new dentist that a friend I met from TikTok that I get to know her recently. She make fabulous content. You guys can go and check her out. All right, also good. All right, good. Go teeth whitening. Okay, teeth cleaning. All right, good. Yeah, good to get your teeth cleaned up. Guys. Okay, question. Okay, electric brush versus normal brush. Which cleans better? Studies have shown that electric brush does clean the teeth better. So yeah, it does clean better. And electric toothbrush also a lot more fun. But saying so, if you have the right technique, you brush all the three surface, the front surface, the outside surface, the biting surface, the inside surface, and then you floss in between the teeth. If you clean all round, you'll be fine also. All right, good. How does Disclosing tablet taste like? It tastes sweet though. Okay, it tastes kind of sweet. All right, and yeah, sweet. My younger daughter says it smells like banana. I don't know, leh. I don't know about that. Yeah, yeah. Yes, I'm from Singapore. Okay, not Peizi. Hi. Good. All right. No Disclosing tablet. Sorry, guys. Actually, I planned to do this at home. But today was so busy. Then I realized I promised my wife to be going out for dinner. That's why I'm now at M Hotel. So I finish work, I pick her, then I come back M Hotel and finish dinner, I come up here and do the live with everyone here. Is flossing your teeth fine after eating? I promise the next live I must bring all my things here. Okay, but at least I realized I don't have a lot of equipment. Sorry, guys. Yeah, but okay. At least I have one model. This is a model I borrowed from the clinic. Okay, this is the braces model. There's different type of braces that we're looking at here. We have the invisible brace. These are the ceramic braces. Okay, these are traditional braces. These are traditional braces, and these are the ceramic ones, and these are the metal ones. So aesthetic wise, of course, the ceramic ones are better. The best will still be invisible braces, of course. Okay, best type. I would say nowadays you have the invisible braces. You can take in, take out, and a lot more easier for you to clean. You can also easier for you to clean and also to have your food. So I think the invisible braces, Invisalign, or so many different ones out there. What's my favorite character in Squid Game? There's so many. 4-5 player 456. Okay, I liked 001 also. Yeah, some of the people say that I look like 001. I sound younger. Alright, guys. Okay. Thank you, Tristan. Okay. Off Tristan, but 436. Alright. Thanks, guys, for following on TikTok and also subscribe on the YouTube. And remember to, if you're on TikTok, give me more likes, spams the likes and share this so more people can see this. And also on friends on YouTube, remember to like this video, okay, and ask your question. All right, Ashin, okay, please say your name. Good. Yeah, after a while, I also don't know whether is it the asking question is more interesting, or I think shouting out and saying hi to everyone are more interesting. Wow, thanks for the hand sanitizer, for the alcohol spray, not hand sanitizer. All right. Do water flosser work? Wow, have a paper crane also. This is the first time I got a paper crane. Thanks, Carlton. All right. Is it cold in Singapore? No, not exactly. I think we're about 30 degrees. Jamie Murray, you just subscribe to the YouTube channel. That's awesome. Welcome aboard. All right. Okay. Good. Thank you very much. Okay. Carlton. Okay. All right. Glad to be your favorite dentist. Okay. Good. All right. Good. Wow, 14 degrees. It must be quite cold. Out there. All right. Good. Yeah, getting colder now. Yeah, I guess afternoon we have a fair bit of rain, so it can be a little bit more colder. Hi, Peach. Hi, Peach. Good to have you here. All right. Good. Peach has been watching the past few days. At when I premiere live on premiere video on YouTube, she has been around every single day. I think at least 3-4 days already, every day. Or what's my favorite fruit? That will be maybe chicken rice, durian, KFC, fried chicken. Yeah, I must learn to eat less fried food though. All right, thanks. Dream MZY. Hi. Emily, hi. Is it okay to teeth to drop 7 or more in a month? Is it okay for teeth to drop 7 or more in a month? If it's a milk teeth, usually it shouldn't be an issue. But usually we don't drop 7 or more teeth in a month. There's still a sequence. Yeah. Okay. What about durian fruit? All right. Yeah. Thanks. Yeah. Guys, good. Yeah, thanks for subscribing, guys. Okay, is it brushing 3 times a day is a good idea? Studies have shown, or actually 2 times and to 3 times is actually fine. So that's actually okay. So 2 to 3 times is actually fine. Really depends on your for baby teeth. Okay. Yeah, if it's baby teeth, usually not the issue end of the day, if your adult teeth is coming up, replacing them, you'll be fine. Also, not to be too worried. Okay. Good. What's the best method for brushing your teeth? Okay, the best method for brushing teeth will be the modified bus technique. Okay, where I don't have the 2 model. The only model I have is actually the braces model. So you want to angle your toothbrush at 45 degree to the tooth. Okay, jiggle into the gum space, then brush upwards. I don't have a toothbrush, sorry. I didn't plan to be doing this live in the car, so that's why. But now you can angle it 45 degrees, squeeze the bristles into the pocket, then jiggle, then brush upwards. You can check out my other TikTok and YouTube videos to actually see the modified bus technique. Okay, you can just put down brushing technique. Dr. Tristan, they will come up with some technique. Okay, you can look at it. Yeah, I'm staying in Singapore. All right, in Dilidan. Okay, Farrer Road. All right, that's the condo that I'm staying. I'm staying in the high floor. Actually, it's 27th floor. Yeah, high floor. So we got this place, I think, since 2013. Yeah, love this place. Yeah, you know, we have a very nice view at the balcony there, very cooling also. And when it rains, sometimes it can be crazy, like thunderstorms outside. So that's my place. All right, I guess in the car better, the sound. It's a lot more quiet, and the sound is audio is a lot more better. Am I right? Is it better? Okay, Venom. All right, I see a Venom there. Should I use mouthwash regularly? That's a very good question. Okay, to brush your teeth, there are two ways to brush. Okay, there are two general way. Of course, the first way is the mechanical way of brushing, which is your brushing and flossing. Okay, go back. Okay, you have mechanical way and chemical way. Mechanical way, brushing and flossing. So brush 2 times a day and floss every night. These are the most important way to clean the teeth. The chemical way, of course, will be using mouthwash. So mouthwash is an adjunct, something additional. Usually, I wouldn't suggest using mouthwash unless if the gums are not ideal, then you can use the mouthwash. Or if you feel that your mouth you like the fresh taste from the mouthwash, then of course you can use the mouthwash also. I think everyone has a choice, and that's just hearing from me. Okay, you have your own choice also. Yellow teeth. Okay, all right. Our teeth is naturally yellow due to the second layer dentin. Do I have the one? Oh yeah, I don't have. I didn't. All right. Our teeth is naturally yellow due to the second layer dentin. Do I have the model? Okay, it's okay. It's okay. So it has 3 layers. Enamel is a white color layer. The second layer is the dentin. The third layer, of course, is the nerve. So our enamel layer is thin, which is whitish, but our general second layer dentin is slightly yellow. So what we see, it's the slightly yellow is due to the second layer dentin, and that's very normal. So most people see the yellowness on our teeth and end up they brush harder. Okay, why? Why do people brush harder? They want to clean away the yellowness, but not understanding that the yellow is the natural layer. They brush harder, they actually wear away the enamel. And when you brush very hard, every day and night, 2 times a day, and you brush very hard, it's the same as cleaning a table. If I clean a table with a soft cloth, I clean it this way every day, the table will clean nice and shiny. But if I clean my table every day with a lot of strength, with a hard brush, over time the table will also wear. Okay, so the 3 layer enamel will wear off first. Enamel is the hardest, usually doesn't wear so easily, but when we clean with a hard brush with a lot of strength over time, because of yellowness, we want to make it white, we clean until the enamel wear off, then the teeth will look more yellow. Or if you clean away too hard, you brush too hard, the enamel wear off, especially at the root area. The root area is definitely more yellow, and sometimes most people see the yellowness, they thought it's not clean, they brush even harder. The harder they brush, it wears more, it becomes more and more sensitive also. So brush gently, in short, okay? Or don't use too much strength. And of course, how to get the teeth cleaner, okay? To clean your teeth, brush well, floss well with at home, that's what you can do. If it's still not good enough, then of course see your dentist every 6 months or 1 yearly for a good cleanup. The cleaning will help to remove all the surface stains. You see, there are 2 types of stains on the teeth to make the teeth look whiter. Number 1 is the surface stains. Surface stains by brushing well at home, cleaning well at home, and also see your dentist for cleaning. Professional cleaning help to your dentist or hygienist to scrub everything up to make them nice and shiny. Okay, so these are the 2 ways. Then of course, a professional, if you want to improve the color, this is the intrinsic stains or the color, the color, improve the color of the teeth. Then you look at teeth whitening, or you have chairside teeth whitening. You have customized whitening tray. You can also have over-the-counter whitening product like toothpaste or white strips. These are the ways you can whiten teeth. If after doing all this, it's still not good enough, because how white is white? Everyone's perception is different. Some people say my teeth is white. Some people feel that it's yellow. You can't please everyone. You really can't please everyone. Just be happy with yourself. And sometimes social media can be quite scary. When so many people, sometimes the comments on my color of my teeth also can be quite a fair bit. Yeah, just have to take it with a pinch of salt. How white is white? There's no perfect smile. There's no perfect smile. Just there's no perfect color. All right, just for me, health is most important. Brush well, floss well. Make sure you don't have any decay. 0 decay. I have no fillings done before. yeah, I love brushing my teeth. All right. Okay. So yeah. Right. Okay. Good. Just to share with you all, everyone, a little bit more on that. All right. Which toothpaste is the best? Okay. When it comes to toothpaste, just two things. Generally, two things for general first. Always choose a toothpaste with at least 1,000 parts per million of fluoride. Okay, fluoride helps to prevent decay, so fluoride concentration important. 1,000, at least 1,000 parts per million of fluoride. That is the first criteria that I will share with everyone on toothpaste. The second criteria, of course, choose a flavor that you like. A flavor that you enjoy, and then of course you use it more regularly. Then you brush 2 times a day. All right, so two things very important. Okay, number one is the fluoride concentration. Number two is our a flavor that you like. Okay, of course, the third thing, okay, it depends whether you have these are the more if you have sensitivity. Okay, if you have teeth sensitivity, then of course you can use a toothpaste for sensitive teeth. Okay, if you want your teeth whiten, of course you can use a whitening toothpaste. For whitening, do take note that most of the toothpaste we see outside when they say whitening, actually is cleaning. Okay, all toothpaste will have abrasive that will help to clean away surface stains, and when you clean away surface stains, the teeth will look nicer, cleaner, whiter. Okay, whiter. Okay, whiter as in you clean away the stains, it looks cleaner. Okay, so this is what most of the whitening toothpaste outside. For a true teeth whitening toothpaste, okay, a true teeth whitening toothpaste will contain either hydrogen peroxide or carbonate peroxide, hydrogen peroxide or carbonate peroxide. These two ingredients are the main ingredients responsible for teeth whitening. So of course the question is, can I just use hydrogen peroxide? I get it from market, just use it. You see, anything that is not in proper concentration will not be good for the teeth. So don't do that. Always go with proper formulated toothpaste or any products, dental products they have done research before using it, or they're passed through the government health agency before you use that. So don't go with there's so many options out there. Don't go with that. Good. Yeah, just choose the right product, and that will be good. Okay, so good. Yes, thanks guys. Okay, wow, we have 9.2k likes on TikTok. Okay, thanks guys for the likes. All right, and yes, we have 299 likes on YouTube. Okay, the numbers doesn't matter. Okay, good to have everyone. Thanks guys. Good. Yeah, okay, your orthodontist say wearing rubber bands only at night, but if I want to wear them all round, will I cause more damage or be better? I really don't do braces. I guess good to check with orthodontist. I don't really do braces though. Yeah, I guess if you wear it longer, it should help with the movement. So it should move faster, I guess. Shout out to who? Sharek. Okay, Kodabak. Shout out to you. You're having a player 456 profile. I love Squid Game. Glad you enjoyed the advice. Okay, guys. Good. Okay. How to get stains off from your teeth? Brush well, floss well. What cause stains? Coffee, tea, wine, curry, a lot of things actually cause stain. So how to remove stains? Limit intake of all this sugary food. Limit intake of food that cause stain. Okay. But in life, sometimes there's certain things we enjoy. So just take it. It's like how to have a pair of shoe. How to have a pair of shoe always clean and white. How to have a pair of shoe always clean and white? By not wearing it. How can you have your teeth always clean and no stain? By not using it, which is not possible. So in life, enjoy the food you want. Okay, enjoy the food you want and brush well, floss well, then see your dentist every 6 months or 1 yearly for a cleanup. Okay, but be ready. If you want to take food with a lot of stains like coffee, tea, wine, curry, right, it's fine to take, but don't keep sipping. Okay. Oh, I need the battery for my phone. Okay, luckily I got a lot of spare battery. Just a second, just in case I don't want the phone. I don't want the battery to go down. Yeah, good. That's better. Yeah, charging. Sorry guys. Okay, good. Oh, it's charging. Is it charging? Charger for. I'm using two phones now. Okay, one for TikTok and one for YouTube. All right. Okay, and yeah, I lost my thoughts. What am I talking about just now? sorry. Don't spam, guys. Don't spam. Okay, spamming is not good. It's not cool. Okay, best candies for braces. What's the best candy? Nothing too hard will be good. Okay, nothing. Generally, what is okay for braces? Nothing too hard. Extremely hard can cause braces to break, to dislodge, and can cause the teeth to chip. Okay, and of course, nothing too sticky. Otherwise, it's so difficult to clean. That's just generally what we're looking at here. All right, good. Yeah, all right, good. Hi, friends from India. Yes. Okay, good. Yes, J TikToker. Good. Where do you find Disclosing tablet last time? I got most of my Disclosing tablet from Amazon. Okay. Wow. So many. Thanks guys on TikTok and YouTube. Okay, for watching. All right, good to have everyone here. Here's some tips for tonsil. Okay. Tonsil stones. When we're not so hydrated or we're not having a good oral hygiene, then we do have tonsil stones. And generally, if it's not bothering you, just drink lots of water or have brush well, floss well, and I think that's normally good. However, if this is too frequent, okay, then you might want to see your medical doctor or your dentist to have the tonsil removed. Okay, I don't do this tonsil procedure. Why is there blood in my mouth when you brush? That's a very good question. Okay, when you brush your teeth, this is from Jesu JRNL. Okay, Jesu JRNL. Okay, so normally if you brush your teeth, if your gums are healthy, okay, pink healthy gums does not bleed. Okay, when the gums bleed, it means that it's not ideal. What most people do when the gums are bleeding is that they do not touch it. You see, if this is the tooth, most people when they brush, if they brush well, healthy gums won't bleed. But if the gums are bleeding when they brush, they feel afraid, which is very normal. When people are afraid of bleeding gums, what they do is they actually brush half the teeth. When you brush half the teeth, what will happen? When you brush half the teeth, what will happen? The gum will not break. The gum will not bleed, of course. If the gums don't bleed, then we feel good. We feel good, then we keep doing the same thing. And if you only clean half the teeth every day, morning and night for 2 times a day, and we think that we're doing a good job, but one fine day you accidentally clean the lower part of the tooth, then what will happen? It will bleed. And then because more and more things are stuck at the gum area level. So if you have dental plaque, okay, that's why disclosing tablets are useful for you to know where to improve. So if you have dental plaque at the base of the gum, you're not able to clean it well, then the gums will be red, inflamed, okay, and that will not be good. Okay, so when the gums are inflamed, red, we're not cleaning it, the plaque will harden to form stones or tartars. Then these stones or tartars will attract more plaque. Then the stones get deeper, thicker. All right. Okay. So this is what we are looking in here, not thicker and deeper. Then of course, so in short, if the gums are bleeding, clean it well, keep cleaning, it will get better. Of course, not getting better, please see your dentist or hygienist, dental hygienist for a good check and clean. All right. What happens when you brush your teeth every day, but don't floss? Okay. Yeah, what will happen? All right, if you brush your teeth every day, brushing clean 3 surfaces, the outside surface, the biting surface, and the inside surface. By cleaning these 3 surfaces well, then of course these 3 surfaces will be good. Okay, good means the gums will be healthy, surface clean, there's no decay, no food trap, gums will be pink and healthy. But there's still one more surface, which is the in-between. Also imagine in between the teeth, if you don't clean well, things get stuck. Gums can be inflamed, decay can happen. So you're doing well with the brushing, but just one more phase to get it better, then you can have good teeth for life. So it's the same as like maybe you want to clean something well, but you don't clean it too well. So one surface you don't clean. If you want to clean your hand, okay, imagine I would just want to clean my front, my back surface, but I don't want to clean my in-between well. So of course it will not be so clean. So if you want to clean your hands well, like clean your teeth well, make sure you clean all the surfaces, the front surface, the back surface, and in between by flossing. Alright, I hope that, yeah, so flossing is important. Actually, flossing is important. I also know about flossing maybe when I was in year 2 dental school, when I was like 22 years old. That's when I first started flossing. My professor said that, well, before we start seeing patients, we have to learn to floss, and we'll floss ourselves. And I was quite reluctant because it bleeds. And when I floss, the gums bleed, and I was like, wow. And the first time I flossed my teeth, guys, it took me 1 whole hour. I was like thinking, wow, who really can spend 1 hour to floss teeth? It's pretty crazy. And yeah, it took 1 hour to floss my teeth back then. Yeah. So, but with time, we all get better. With time, we all get better. So when you floss your teeth, if it's bleeding, keep flossing. When you keep flossing, it will get better with time. Thanks for the rose, Jojo Pan Sai. Jojo Pan Sai. Thanks for the rose. Thanks. Okay, thanks for the gifts and the super chat, everyone. Why does people wear braces? And the likes. Oh, we have 16k likes on TikTok. Thanks, guys. Thanks, Mia Suki. Thanks for being a big fan. All right, Ethan, Samuel. Hi. Ethan, Samuel. Good. Poos. Rune plays. Ask me to say Poos. You don't use braces? Fine, it's fine. Not everyone needs braces. I also haven't done braces before. Okay. Braces help to straighten your teeth, make it look better. Okay. Improve aesthetics. You can brush better, floss better. You can. The speech pronunciation maybe will be better, chewing better also. Okay, so these are some of the reasons why you can do braces. Alright, good. Do I play Among Us? I used to play, but not so much now, Among Us. But it was fun. Yeah. Alright, hey Queens J, thanks for the super chat. Okay. Alright, Queens is asking, wisdom tooth surgery recovery as painful as people say it is? Wisdom tooth procedure, okay, we talk about wisdom tooth procedure first, then we talk about recovery. Okay, wisdom tooth procedure is usually not so painful as long as you brush well. Wisdom tooth recovery, it's as long as during the procedure, how to make the procedure more comfortable, 2 things, numbing the area well and communicating well with the dentist. So when the dentist will numb the area, once you numb the area, the only thing you feel is a sense of touch and no pain. It must be 100% numb so that the only thing you feel is pressure. Alright? And after and during the procedure, at any point in time, if you're doing any procedure, be it wisdom tooth surgery or fillings or so, always have communications with your dentist. With my patients, I always tell them that if any point in time you're not comfortable, just raise your hand. Let us know. If you're not comfortable raising your hand, don't worry. I'll look at the facial expression. I'm very sensitive to facial expression. When they move, okay, I will move with them. Okay, and so when my patient suddenly moves, something can shock me also. Because sometimes they can be moving too slowly, and yeah, they can move too slowly, and sometimes we look at the facial expression, or sometimes they're so afraid they forget to raise hand. So always establish all this understanding with your dentist, raising hand, then they will know how to look after you better. Okay, so going back, of course, if the procedure is very complex, then of course the recovery will take a little bit more time. Okay, how to make the procedure more comfortable? Okay, brushing well, flossing, cleaning the area well. Then of course, don't use the gauze every half an hour change. In fact, I done a YouTube video on what the things to do after wisdom tooth surgery. That's normally what I would do when I after seeing my patients for wisdom tooth surgery. I will actually forward the link to my patients so they can have a look at that on what are the things to do after wisdom tooth surgery. So how to make it more comfortable, taking your painkillers, keeping it clean, talk through everything a little bit slower. So going to the main answer, how to make after wisdom tooth procedure, how to make the area better. Okay, talk through everything a little bit slower. There's actually a string called stitches or sutures that is placed at the surgical site. The suture or stitches will limit movement, so talk through everything slow so that it'll be more comfortable. Okay, and of course what we're looking at here, of course, food wise, okay, chew more on the other side. If you are doing the procedure here, then chew on the right hand side. Nothing too hard. Rice and noodles is fine, but not the crispy ones. Porridge, yogurt, ice cream, pancakes, drinks, Milos, all these are good also. Ice creams are great. Okay, so this is what you can do, chew on the other side and keep it in area clean. When you want to drink, don't drink with a straw. When you drink with a straw, the negative suction sometimes can cause the blood clot to dislodge, then start bleeding. Okay, so don't drink with a straw, drink direct from a cup. Okay, so this is what we can do. Does watching your phone makes your eyes blur? Anything in excess will not be good. So good to limit your exposure to phone. I've really been using a lot of phone. Now I'm using 2 phones on TikTok and also on YouTube. Alright, really a lot of phones. Yeah, so good to limit. What age can we do jaw surgery? Patients who do jaw surgery usually is after growth. After growth, end of growth is at least maybe 20 plus. Okay, and after end of growth, then you do surgery. So if we have the lower jaw, it's a little more hard. So sometimes we can do surgery to actually move the jaw backwards so that we and braces, then we can get the alignment of the teeth better. Good. I'm from the University of Singapore. NUS, National University of Singapore. All right, good. Yeah, should do an electric toothbrush, is it? Okay, good. Can try the film electric toothbrush when it's turned off. Okay. Thanks guys for the share and liking the videos. Good to have everyone here. Okay. Hi, Christy. Hi guys. Is jaw surgery expensive? Yeah, jaw surgery is expensive. The amount of the procedures and expertise. Okay, pitch. Okay. Why do our teeth hurts when coming new? Well, when the teeth is coming out from the gums, okay, pitch from YouTube is asking. So if our teeth is coming out from the gum, okay, the new teeth actually pushes out from the gum, so that actually causes the discomfort, I guess. Yeah, that's the discomfort. If it's hurting you, okay, you can always take something cold, ice creams, okay, that will be more comfortable also. Alright, do you floss? Definitely good to brush 2 times a day and floss every night, guys. Okay, flossing helps to clean in between the teeth well. Okay, what car is this? I'm driving an Estima, Toyota Estima. Okay, and the family car. How many seater? We have a 7-seater car. Alright, and friends from Philippines. Hi. I'm staying in Singapore and yeah, good. Mouthwash, it's an adjunct. I don't think it's really necessary. I don't feel that. I mean, it's just my opinion. Everyone has their own opinion, right? But I also seen patients who love mouthwash. Why? Because of fresh taste. Okay. David Cohen loves mouthwash. Watch his video. He done a lot of video on mouthwash. He done a lot of video on mouthwash, eating garlic, and after that mouthwash. If you like Dental Digest videos, you might actually like his video also. Different. Yeah, very different. All right, good. Rude customer. Oh, have you had rude customer? You can still remember. Well, I have a lot of fearful patients sometimes. Yeah, fearful. Rude, not as much. Okay, but sometimes everyone could have a bad day also. So let's give everyone a little bit of a slack. So sometimes people can have bad days and well, they behave how they behave. So always good, even if always good to give a lot more care and empathy. I think the key thing I learned from dental school is empathy and to feel for the patients and to care for them, caring and feeling, especially if they're fearful. Care as much as you can and make them more comfortable, because when a patient is fearful, they finally come down to the dental chair. Actually, that's a great achievement really for all the people watching here. If you're fearful, the first step to do is to actually make the first appointment to go down to the dental clinic. Of course, if you're fearful, also bring along your family members with you. bring a family member along with you. That would be great. You can also bring earpiece to listen, but of course let your dentist or the front people know, the front desk staff knows that you have some fear, and so that to look out for you. Okay, and don't be fearful of letting them know. It's good to let them know. I appreciate my patients who let me know. Why? If they let me know, I know how to look after them better, and I can encourage them more along the way. And if I can encourage them along the way more, then they will feel more better. And when they feel better, then it's easier for me also. Yeah, it's easier for me also, guys. All right, good. Hi, friends from South Korea. Yes. Why wisdom tooth doesn't come out and the other does? Okay. Wisdom tooth. Why? Okay. Who asked this? Okay. Cloud head squad was asking. Okay. Why wisdom tooth sometimes come out, sometimes don't come out? A wisdom tooth is a variable. It can be 0, 1, 2, 3, or 4. Usually, wisdom tooth is the third molar, or first molar, second molar. The third molar is the big tooth, the last one. In the past, our jaw is a lot more wider, but through evolution, it becomes shorter. So that's why there's hardly enough space for the wisdom tooth to come out. So the wisdom tooth can be a variable. It can be 1, 2, it can be 0, 1, 2, 3, 4. Yeah, wisdom tooth. So to know more, of course, good to see your dentist. They can take an X-ray to have a look to let you know how many wisdom tooth you have. Okay, flossing helps to clean in between the teeth. Okay, brushing, imagine I'm cleaning my hand. Okay, if you are looking at brushing your teeth, it's like cleaning your hand. If you brush your teeth, brushing helps to clean the front part and the back part and the top part, but flossing cleans the in between. Okay, so if you only clean your hand, if you only brush your hand front, top and back, but you don't floss your teeth, of course this area here we can't clean well. If you can't clean the whole hand well, that will not be good, right? So same thing, that's the reason why you need to floss lah. Flossing helps to clean the in between the teeth that our toothbrush cannot reach. Okay, is Invisalign worth it? It really depends on everyone. Braces or Invisalign. If you're happy with your smile, even if it's not aligned, then you're happy with your smile. Okay, but of course, well-aligned teeth make you smile better, easier to chew, and also easier to clean. Okay, so yeah, it's a good idea to have braces. If your teeth is very not aligned, then there's a lot of difference. But if your teeth is somehow quite aligned but not perfect, then it might not be necessary. Okay, braces fee, it depends on your local clinic. Go to check with them. I don't do braces. I have colleagues in my clinic that does braces. If you're keen to do braces with my colleagues, you can check out the link in the bio. I don't do braces. Okay. I have keen interest in wisdom tooth surgery, preventive dentistry, cleaning. Yeah, that's basically the things I do. I stopped doing a lot of things. I don't do dentures, implants. I used to do dental implants. Yeah, but after a while I stopped. I spent quite a fair bit of time traveling to the Korea, to States, to pick up dental skills, dental implant skills. But yeah, I choose to do less. Yeah, so doing less now, so that I have more time to do TikTok also and YouTube. All right, okay. If your teeth is permanent, can you check without the X-ray? Yes, the dentist or dental hygienist with the dental knowledge, they are able to see whether it's a milk teeth or adult teeth. They can actually look at it. They can tell. All right. But always a good idea to take an X-ray also to have an overview look, to see overview look so that they will know if there's any area to be better. Wow, guys, we are about 40 minutes already. All right, good. 18.5k likes on TikTok. Guys, thanks for let's slow down a little bit, and I want to look at the comment section. And I actually went for a short course on Invisalign, but I really didn't really start doing it. Okay, I guess a short course is good, but to really want to do more, you need to really study braces more. Yeah, to do it. All right, good. Okay. What type of shampoo can make our hair long? You ask me about shampoo? Can't you see my receding hairline? I don't think I'm the best person to recommend shampoo. Yeah, I just use a shampoo that's cooling off. I like minty toothpaste. I also like minty shampoo. That's just me. I like cooling, and it feels cooling and refreshing. Maybe that's why it caused receding hairline. I have no idea. Do you know what can do if you have a cut in your tooth? Okay, if you have a chip on your tooth, okay, if you have a chip or a cut on your tooth, what can you do? Okay, it depends on how cheap. Okay, a very fine chip that is not bothering you, then don't do anything. Okay, a bigger chip, okay, but it's rough. A small chip but it's rough, it's bothering you, then go to see a dentist. A dentist can polish it to round off the sharp edges to be more comfortable lah. Okay, and if the chip is a bit more, okay, then of course your dentist can do a filling, okay, a filling to shape it to make it look good. And if the filling is if the chip is a lot more bigger, of course they can do a bigger filling, or something a lot more stronger is a crown. A crown is like a helmet to cover up the tooth to give it more strength. Okay, that's what you can do. Okay, but of course early phase slight chip bothering you, also a good idea to let the dentist have a look. Don't wait until it's a bigger issue. Small issue always easier to look out for. Alright, Jovial Ho 2009, you're saying that I'm looking handsome. I was going to say I was born handsome. No, just joking. I don't think I'm the best looking person, but yeah, just smile and have fun, guys. It's okay. All right, it's okay. Good. I realized that in the past, when I was younger, I always feel that I'm not good looking. I don't feel that I'm so good. So there's a lot of self-esteem is actually very low. But it took me a while to keep practicing, to keep getting better. And after a while, when you're going dating, you have to believe that you are the best. Okay, especially when you're going dating, guys. Okay, and when I go dating, I arrange my yeah, dating is like interviews so interviewing for your future wife and or husbands so yeah, so looking good, be confident, and I used to be very bad with my very bad with girls. Okay, I was from all boys school, so when I was in pre-university in college, when I have classmates who are girls, when they talk to me, sometimes I can tongue tied. Terrible, right? Now I can talk better. But anyway, yeah, that's just my story. All right, how old were you when you got married? That will be maybe about 28 years old. Yeah, I think 28. I graduated 24, 25, somewhere around there. yeah, maybe after graduation 1 year, then I got my girlfriend, and after that, then yeah, correct. Yeah, be confident. You're the best person. Okay, everyone, you're the best person, and you will, and keep getting better. Okay, be confident is one thing. Confident without knowledge, it's doesn't work. You have to be confident, and you keep learning things and keep getting better. And of course, also must be humble. Being humble is the most important. Otherwise, when you're too confident, you will go to the extreme end and usually will fall. yeah, so always good to be a little bit more humble. Yeah. Okay, toothpaste. Okay, we talked about toothpaste actually just now already. Just a quick one. Okay, toothpaste. Use fluoridated toothpaste. Choose a flavor that you like. Then of course, if you have sensitivity, then of course go with either sensitive toothpaste, or if you want teeth whitening, then go with toothpaste for either with hydrogen peroxide or carbon peroxide. Usually, whitening toothpaste can cause a little bit of sensitivity. How Disclosing tablet work? Actually, I've done that before. Yeah, you can check out my videos somewhere. Just Google, YouTube, or TikTok. You can find that there. Or Disclosing tablet makes dental plug visible. How you use it? You bite, swirl, spit. This is how you can use it. All right, guys. Thank you everyone for being here. You know what? Okay, got to go and get my wife back home also. All right, and really lovely, and I'm so happy to have everyone here. Remember to subscribe YouTube, follow me on TikTok, go to Instagram, and also check out the link tree in the bio here, or maybe not in this video on YouTube yet. I'll put in the link tree link later. You can go and check it out. The link tree everything is there, and just see where do you want to consume my content, and just follow me there. All right, so I will see you all soon again. All right, thanks guys.